Brittany.
Yes.
I'm Erin. Welcome to the office.
Thank you.
I have some paperwork for you. Came a little early for your consult, which is great. We have just a few pages, patient registration, health history, pharmacy, and then of course our HIPAA release as well.
Okay.
Here you go. Take your time. If you'd like to hook up a device also, we have free Wi-Fi. And if you need to use the restroom,
Awesome.
they're right through those two doors on the left. No need to ask.
Okay, thank
Take
you.
your time, fill it out, and bring your insurance card back up, and we'll get you started.
Thank you.
You're very welcome.
Brittany.
Yes.
Hi, I'm Judy.
Hello.
Nice to meet you.
You too.
Welcome to our practice. We're going to go back and see Dr. Garvey.
Okay, thank you.
You can just follow me.
I like all the pictures.
Well, thank you. Now you can have a seat right here, Brittany, all right?
Ooh, Ireland. I've always wanted to go there.
It's a beautiful country.
At least I get to stare at that for a
Yes.
while.
So, I know you're here today to talk about having your wisdom teeth removed.
Yes.
Okay, are you having any problems with them?
The one has been giving me some pain, so my dentist recommended just taking them all out, and I figured why not?
All right, well, let me get everything ready for Dr. Garvey. Do you have any questions while I'm getting that ready? Feel free to ask, all right?
Okay. Sorry, I was looking at
Yeah.
the diagrams.
Yeah, and so now when Dr. Garvey comes in, he's going to...
Hi,
Hello.
I'm Dr. Mike Garvey. How are you?
Nice to meet you.
It's great to meet you.
Nice to meet you.
Yeah. Having some trouble with one of your wisdom
Yeah,
teeth?
the
huh?
one's been giving me some pain.
How long has that been going on?
On and off, probably the last 6 months
Okay.
or
Okay. And what do you do to help it? Anything?
so. I've tried flossing around it and, making sure that I'm taking care of it, but, it's...
Sometimes they're so far back, it's hard to do that. And this is not uncommon. People have this trouble a lot. I see that you're a pretty healthy person. Is that correct?
well, I believe so.
Okay.
I
Are you
hope so.
taking any medicines?
I take Tylenol for my back pain.
Okay. But no prescription medicines for health issues?
No,
Okay. How old are you?
I'm 30.
30. All right, fine. Good. Just lean back for me a little bit and open big. Okay. And stick your tongue out all the way. Very good. Okay, go back. Oh yeah, that looks like it's a little angry. Gently bite your teeth together now. Good. Did you have braces?
Yes, I did.
Looks really good.
Thank you.
You take good care of your teeth. I'm proud for you.
I try to.
Wisdom teeth are just troublemakers, okay? They inevitably create a problem for people. They're the last teeth to form, and they come in after all the other teeth have taken up all the room, and they never get to where they need to be useful. And even those rare cases where they do, they're so far back that maintaining them is very difficult. So it's not uncommon for patients to come in and see us and talk about getting their wisdom teeth removed. Most of the folks who come to see us are either young people or they're folks who are a little more mature and are having a problem. Very frequently people aren't having a problem, and we're going to help them head those things off.
Okay.
Wisdom teeth are a little different than other teeth, and their extraction is a little different than just a routine dental extraction that many people have had. There are some complications. They're very rare, and on your x-ray I see no risk factors. I'm going to tell you about these real quick, but it's not something that you need to lose any sleep over, okay?
Which is good. Calm me down a little.
Okay. There are some nerves that run under the wisdom teeth through the jaw that give you feeling on your lip and chin. Injury to those nerves would give somebody some numb spots on their lip and chin. We almost never see this, and again, there's no risk noted on your x-rays or looking at you. Jaw fracture, injury to other teeth, sinus injuries. I got to tell you about these things because I can never say there's no risk, but on the other hand, it's not something that's serious enough that it really has an impact on our discussion.
I totally understand.
Okay? Most of our patients are sedated for wisdom tooth procedures, and we think this is a really good
Please.
idea. So
Yes, please.
You come and see us with an empty tummy, nothing to eat or drink after midnight, and somebody's
Okay.
got to bring you to take you home because you are not going to be driving home.
No, I would hope not.
All right, when you get in, we'll put some monitors on, like blood pressure and heart monitors.
Okay.
And I'll listen and make sure your chest is clear that day and that you're feeling okay. And then we'll give you some medicine through an IV, like a little shot in the arm. You'll get pretty sleepy and comfortable right out of the gate. And while we're getting ready to do the rest of our procedure, we'll give you a little more medicine and you'll get quite relaxed and sleepy.
Sounds good.
We'll give you some Novocaine. You won't know we're doing that. We'll wiggle those teeth out of there. You won't know we're doing that either. When
Perfect.
we're all done, you'll recover from the sedative medication, and when you're strong enough, we'll get your escort back here and run over some post-operative care. It's all written down, and the numbers to call me are there. So if you ever need
Okay.
me for anything, anytime, day or night, pick up the phone. If
Okay.
you're having a problem, I need to know about it.
Okay.
You'll take some pain medicine and eat a soft diet probably for 3 or 4 days. The day of course, because of the sedative medication, is a wasted day. You lay around and do nothing. Okay, it's real important.
My kind of day.
Yeah, it's one upside to this whole thing, I guess. And then we will telephone you periodically during the post-operative period to make sure that everything is going along smooth. You'll have a prescription at your pharmacy, and with the post-op instructions, you should be able to get through this post-operative course of 3 or 4 days very comfortably and
Okay.
effectively.
Sounds good. Yeah.
Does that make sense to you?
Yep. My husband just had the procedure a couple of years ago, so
Okay.
I'm kind of familiar with
Yeah.
how it went for him,
Right.
Chipmunk.
Well, each person is different,
Okay.
and we can look to those experiences for some guidance, but my hope is you're going to do a lot better than that.
Okay. Sounds good to me.
Okay,
Okay.
then Judy is going to go over some paperwork with you, consents and that kind of stuff, and then
Okay.
she'll take you up front, and the ladies will find a time that's good for you.
Sounds good.
Now, the pain that you're having, is this keeping you up at night?
Sometimes not every night, but some nights it does.
Okay. Why don't we get you a prescription for some pain medicine now so that you'll be comfortable until we get you back in here to actually do the procedure.
Okay.
And it doesn't look like it's overtly infected, so I wouldn't recommend an antibiotic at this time.
Okay.
But we may change our mind on that over the next few days as things progress.
Sounds-
Hopefully, we'll get you in here and get this taken care of before we get to that point.
Okay. Thank you very much.
You're welcome very much. And if there's anything I can do for you, or any of the rest of us, that's why we're here.
Okay.
Give us a call.
Thank you very much.
You're welcome.
Okay, Brittany, I'm gonna, like Dr. Garvey said, we're gonna give you a couple consents to go over.
Mhm.
All right. These are pre-op instructions for patients that are having IV sedation, and
Okay.
this is your sedation consent.
Okay.
For surgery, okay? Here, we're gonna take out your 4 wisdom teeth, okay? That's the planned treatment. And these are all of the things that I want you to check off. Read this, check this off, and if you have any questions, I'm right here. Just feel free to ask me. And then if you could just sign everything right here for me.
Yep. I don't need to sign this front sheet.
That is not. That's for
Okay.
you to take home. That's
Okay.
your pre-op instructions for your IV sedation.
Okay.
Okay?
All right.
And I'm just going to get some things ready to send up to Erin at the desk, okay? So
Okay.
that she's ready with your financials when you get up there.
Excellent.
All right? But
Okay.
it's still right here.
Okay.
Okay, I see you have your pharmacy information. Dr. Garvey is sending that to the pharmacy, the pain medication for you. So that if you have any
Wonderful.
trouble sleeping tonight,
Okay. Thank you very
you'll have
much.
that at your
That
disposal.
that will I haven't gotten a full night's rest in a couple days, so.
Oh, maybe that'll work. Yeah. And I'm going to put a little note in here and let Erin know that we would like this done as soon as possible. All right, but you work out the times and dates with her.
Okay, thank you. Okay. Do you need to witness it now, or will you?
Yep.
Okay.
So we're all set. Thanks for signing all that. Any questions on any of these?
Nope, I
Okay.
think everything was pretty
Okay.
straightforward, although
I'm
I
going to...
accidentally, yeah.
Okay, and I'm going to sign here. All right. And I sent everything up electronically to Erin, and she'll be ready for you in just a moment, all right?
Awesome.
So just read that over. I'm just going to check this, and then I'll take you right up front to meet her.
Okay, thank you. Oh, it's snowing.
Erin, this is Brittany.
Hi, Brittany.
It is snowing. Oh, look at this, Brittany. It is snowing. Oh, I'm kidding. Brittany is having some pain, and Dr. Garvey would like to see her as soon as possible.
We can
We've already
definitely do
called
that.
in a script for her.
Okay.
So the first appointment, okay?
Absolutely will do.
Okay,
Thank
Brittany,
you
it was so
much.
nice to
Yes,
meet you,
you
and I
too.
will see you at the surgery appointment, okay?
Thank you.
Okay. If you have any questions, feel free to call.
Okay.
Thank you.
Brittany, I get to go over the fun stuff. Yeah. Let's go over this. So
Okay.
first off, today's consult was $99 out of pocket. We're going to send that insurance information, the claim to the insurance. They're going to reimburse you in full. We double check their fees to make sure for you.
Okay.
So let's go over this. We're going to be doing the extraction of 1, 16, 17, and 32 under general anesthesia. The total treatment cost is $2,724.
Okay.
With your insurance, you have CoreSource. They make payment directly to the patient. So you have a $1,400 maximum with a $50 deductible. So
Okay.
it sounds complicated, but it
Like, oh my
seems that
gosh.
they were going to pay 100% of their fees up to that $1,400 maximum.
Okay. Okay, that makes sense.
Yeah, for
I
our
guess.
surgery patients.
I'd appreciate that tomorrow. So.
Very true.
All right.
It was so nice to meet you, Brittany. If you
too.
do have any questions, don't hesitate on calling, okay?
Okay, thank you very much.
Thank you.
Bye.
Have a great day.
You too.